Good morning.
Good morning.
How are you?
I'm good. How are you?
Good. Do you have 240?
I do.
Okay.
This is John Doe. He's a 15-year-old male. He got admitted last night due to a sickle cell crisis. He was at football practice and he felt extremely fatigued and he had severe abdominal and bone pain.
Okay.
So he came to the ER. He has no known allergies. He has a 20-gauge IV in the right hand with normal saline running at 125 milliliters an hour.
Okay.
At 4, his vitals were blood pressure 110/64, respirations 14, heart rate 74, temp 100.1, O2 sat 94%, and he's on 3 liters on a nasal cannula.
Okay.
At 5:45, his pain was rated a 7 out of 10. He was given acetaminophen 400 milligrams for fever at 4, and oxycodone 10 milligrams for pain at 6.
Okay.
His last floor was at 5, and he had a BM before his admission. He's alert oriented times 3. His labs from the ED show the red blood cell count was low, and the white blood cell and platelet was high. I would suggest reassessing his pain at 7 or as needed, and continue to monitor INO and lab values.
Okay.
Do you have any questions before I go?
I think that's all I need. Thank you.
You're welcome.
Come in.
Good morning. How are you feeling?
Doing pretty good.
Good. How are you?
I'm good, thanks.
Good. So, I heard you had some pain last night. How's your pain right now?
A little bit in my stomach and bones are aching.
Alright. So, on a scale of 1 to 10, how bad would you say that your pain is right now?
About a 4.
Okay. That's good. That means the medicine's working. So, tell me what happened at football practice last night.
Well, coach was making us do laps around the field, and I started to feel more tired and weak than usual, and I just felt like I was going to pass out. So I sat down and I noticed I was starting to hurt all over and sweating a lot because it was hot outside. I've had a couple sickle cell crises before. I knew that's what it was, so I called Mom and she brought me to the ER.
Okay. How much water did you drink yesterday before practice?
Only 1 water bottle at lunch.
Okay. You need to make sure that you drink plenty of water throughout the whole day, especially on days that you know you have football practice. That'll help prevent another sickle cell crisis.
Okay.
Do you know if your coach knows if you have sickle cell?
No.
No, he doesn't know? Okay. We need to let him know so that he can give him more water breaks and rest breaks so he doesn't get dehydrated or overheated, okay?
Okay. I'll make sure he knows.
Okay. Do you ever have mild pain episodes at home?
Sometimes.
Okay. Do you take anything to manage those at all?
No, he normally just sleeps him off.
Okay. Well, the next time that you have a mild pain episode, you can just take some ibuprofen, any NSAID like Tylenol or Advil, anything like that. That'll help lower his pain levels a little bit.
Okay.
So I noticed in your chart that you've been hospitalized several times this year due to severe pain with your sickle cell crisis. Does he take any medication at home to manage his sickle cell?
He doesn't.
Okay. Has your doctor ever talked to you about hydroxyurea?
He was prescribed that a couple of weeks back, but it was just a little too expensive.
Okay, I understand that. I think we've got some coupons. I can grab one for you. You can take it to the pharmacy. That'll help a little bit.
Yeah, that'd be great. Thanks.
Yeah, no problem. So just a little bit about hydroxyurea before we start on it. It's been shown to help a lot of patients manage their sickle cell crisis.
Okay.
It lowers the frequency, lowers the severity, so it could be very beneficial to you, John. So there are a lot of side effects though, and I'll just list a couple of them for you. He can have fever, drowsiness, nausea, vomiting, diarrhea, weight gain, rashes, chills. It also lowers white blood cells, so what that means is he's at more risk for infection, and I know you already are because you have sickle cell. So we'll just need to watch that a little bit closer. So watch for things like sore throat, fever, fatigue, stuff like that.
Okay.
It's just best to take his temperature every day so that you can catch those infections really fast.
Okay.
And another thing though with the infections, I know you take a lot of vaccines. You get vaccines every year to make sure that he doesn't get infections. With hydroxyurea, you can't take any vaccines unless you have your doctor's approval.
Okay.
Okay. Just another thing before you start taking the medicine at home, you will need to wear gloves and wash your hands every time you come into contact with the medicine. Okay, it's just a precaution. But here is a sheet for all of the side effects and precautions with hydroxyurea. Do you have any questions or concerns about the medicine?
The side effects, it's a little concerning that there is so many,
Yeah.
and it's a little scary that you have to wear gloves to actually give the medication.
Yeah, I understand that. There are a lot of side effects, and you do have to take precautions. But for a lot of patients, those benefits outweigh the side effects. So it's just something for both of you guys to think about and talk with your doctor.
Okay, yeah, we'll talk to him when he comes in.
Okay.
All right, thank you.
I'm going to do a quick assessment on you real quick. Is that okay?
Of course. course.
Okay. Just gonna listen to your heart and your lungs real quick, okay? Okay, now take a deep breath every time you feel my stethoscope, okay? I'm just going to listen to your back real quick too, so just sit up for me. Alright, well everything sounds good. Do you guys need anything else before I go?
No, thank you.
Okay, there's a call bell right here on your side rail, so just call me if you need anything else, okay?
All right, thank you very much.
Thanks guys, have a good day.
Thanks, you too.